know you mentioned some of the roles of the gene mutations, but can you explain a little more why myelofibrosis develops and really kind of what causes it?
Yeah, absolutely. So, myelofibrosis, as I mentioned, is considered a cancer, and it's a chronic blood cancer. So, broadly speaking, whenever we talk about cancer, we're talking about cells that stick around longer than they should, that divide more than they should, and typically it's driven by a abnormality. And oftentimes that abnormality is what we call a genetic abnormality. Now, when I say genetic abnormality, what I mean is a mutation in a gene, not necessarily something that a patient was born with. So, most mutations that drive myelofibrosis are what we call acquired or somatic mutations, meaning patients typically are not born with them. They're not at risk of passing them down to children or otherwise. But with time, and we don't really have a great understanding of why this happens, these mutations develop. And as the population of mutated cells in the bone marrow gets bigger and bigger, that's what then leads to the clinical issues we run into. As these cells kind of mutate and divide and proliferate, they secrete a variety of kind of factors in the bone marrow that lead to increased scarring or fibrosis. So they're kind of laying down what we call collagen, there's reticulin, all of these things kind of scar down the bone marrow and ultimately lead to us seeing fibrosis under the microscope when a biopsy is done. And this is the reason why the bone marrow then is not able to make blood cells the way we need it to when myelofibrosis advances.
Great, thank you. Are there any certain age groups, genders, or populations that are more affected by myelofibrosis?
In general, we think of myelofibrosis largely as a disease of patients over the age of 60. That being said, there's been a concerted effort to really study the development of MPNs in what we call the adolescent young adult population, the 18 to 39 years old, because it does seem like there's a small peak that kind of happens in that age group. In that age group, it's much more common to have PV and ET. By the same token, those patients, given how young they are when those diseases develop, over the course of many decades, there's this concern or risk that with time, will this disease turn into myelofibrosis? But overall, when thinking about kind of other other predispositions, whether it be by gender, race, ethnicity, or otherwise, no major ones that kind of come to light. But the biggest one I would say is age. In general, MPNs and myelofibrosis are certainly enriched in patients over the age of 60.